Hello and welcome back to Politics and Polls. I'm Julian Zelizer, a professor of history and public affairs at Princeton University. This is my colleague and co-host, Sam Wong.
Hi there, Sam Wong, professor of neuroscience and director of the Princeton Election Consortium.
So the pandemic we are living through is a crisis on many fronts. It's obviously a public health crisis, but it's also an economic crisis. The lockdown has already had devastating effects on workers who are struggling to get by, on businesses that are shutting down, and obvious fluctuations in the stock market. People are anticipating for the worst. They don't know where this ends, whether we'll be going into a recession, possibly a depression. The federal government has mobilized with a major stimulus package, and it's followed through with more support for small business. But what lies ahead is uncertainty. And there are many questions emerging about what's the best thing, or what are the steps that the government can take to try to alleviate the pain people are feeling and to stabilize the economy. So to discuss some of this with us, we're really fortunate to have Cecilia Rouse, who is the dean of the Woodrow Wilson School here at Princeton University. She served as an editor of the Journal of Labor Economics and a senior editor now for the Future of Children. She's a founding director of Princeton University's Education Research Section, a member of the National Academy of Education, and a research associate at the National Bureau of Economic Research. And she's also been an economist who's been at the table in political and policy discussions. In 1998 to 99, she served a year in the White House at the National Economic Council, and from 2009 to 2011, during the Obama administration, as a member of the President's Council of Economic Advisors. So, Cece, welcome to the show.
Thank you. It's a pleasure to be here.
Maybe you can just, from your perspective, what are some of the most important short-term and long-term economic effects that we know the pandemic is having on the state of our economy right now?
Well, the short-term effects, I think, are the most evident. In order to address the pandemic, we all needed to be physically distant from one another, since we are not able to do a more subtle way of isolating those who might have been exposed or quarantining. And so we've instead take this very blunt instrument, which is a full-scale stay at home and physical distancing. So the short-term effects are we've put a halt to much of our economic activity. And we can see that in the numbers of individuals who are applying for unemployment insurance. The Gallup has been running a weekly poll with their panel, and one can just see the percentage of individuals who either have reduced hours, have been temporarily laid off, or reduced income is up to just over 40% of the labor force. So this has really been a halt to our economic activity. So in the short term, what the government needs to do is help us all do that, because that's what we need to do in order to stem the pandemic. Because ultimately, the way we get back to economic health is to bring this pandemic under control so that we're not all putting our lives at risk by interacting with one another. In my personal opinion, I believe that the CARES Act, which was technically the third phase of federal effort, but the largest by far at $2.2 trillion, covered many of the most important buckets. There was assistance for individuals who had lost their jobs. There was assistance to almost every household through the check that is supposed to be coming in the mail. There was assistance for small business. There was assistance for larger firms. Where we've tripped up is in the implementation, maybe the triumph of hope over actuality, in the sense that this has been a very sudden stop to our economic activity. This was a massive scale up in what our government was trying to do. And it's using systems which just were not designed to respond this quickly or at this scale. So the federal government's on the cusp of potentially doing another round, which is desperately needed. And I think until we bring the pandemic under control, we're just going to need help from the federal government so that individuals can pay their bills, get food to eat, and businesses, especially small businesses, can stay in business, don't have to declare bankruptcy, so that when the pandemic is brought under control, and hopefully that will be sooner than later, or at least we have.
So it seems in terms of economic policy, everyone talks about this trillion plus program package of the stimulus bill. But really what's happening is now we're in a phase where we need government for a stability or foundation phase, just to hold the economy. And then we're looking at another round down the road of recovery policies. So there's kind of two different objectives that we're looking to do right now.
That is very much my view. Right now, we actually don't want stimulus. Stimulus is about trying to fix an economic problem in our economy, so that we need to find an incentive for firms to create jobs, for individuals to get back to work, to generate economic activity. And actually, that's the reverse of what we want to happen right now. We want people to not be doing all of that activity. So right now, I think of it as relief, stability, if you will. But you're absolutely right. The longer this goes on, the more damages that we see in parts of our economy, the more we will need to move into a posture of stimulus. Many people probably heard about the oil futures markets going negative yesterday. Our oil markets are in decline because we're not driving, planes aren't flying, so our oil consumption is way down. That is a component of our productivity and one of our productive resources. So the longer that takes for that to come back, and it really reflects how much activity we're doing since we're so oil dependent, it is a little bit of a harbinger that this will take some time for our economy to heal, especially the longer this goes on.
And what you study labor economics, what can the government do in specific ways to help workers or to help the unemployed in this phase? What are some kinds of policies that would be useful right now?
Well, I think largely this is giving them relief. So it's making sure that our unemployment insurance offices have the staffing that they need and the resources they need to get the unemployment claims to the individuals. I have seen some suggestions, which I think are good ones, about how to stand up and use the federal government to try to shore up our public health system. We know that in order to bring back the economy to help us all leave our homes, we need to have testing, and we're going to need contact tracing, because the idea here is that we're living with the virus until a vaccine has been achieved and is safe and widely available, or we've achieved herd immunity. That could take some time. I'm not the medical expert here. But we know until that happens, we are going to be living with this virus. And so the idea is we're out, maybe physically distancing, we test people frequently so that we know when there's been someone who's been exposed, we can then contact trace who they've been around. So that takes people, it takes resources in order to do that kind of detective work. And that's a perfect place to be putting unemployed workers to work, our newly graduated college seniors in particular, who are entering a job market that doesn't really exist. This might be a kind of AmeriCorps to help shore up our public health system so that we can all get back to what we want to be doing while we wait for the economy to heal.
We are seemingly not very nimble at this at a national level. And so all these things have to respond quickly, whether it be relief to tide people over while the economy shut down, or responding to local re-outbreaks. Imagine a situation in which the current outbreak is under control, death rates come down, and we try to reopen. What mechanisms do we possibly have at hand? And I mean that both in the abstract in terms of what the federal government could do and what it could and what it is doing, and can state mechanisms step in and perform some of these roles that you're describing?
Oh, absolutely. In fact, our public health system is not just a federal system. We've got the National Institutes of Health and the Center for Disease Control, the CDC, at the national level, but states have their own systems as well. And I was reminded by one of our graduates of the Woodrow Wilson School, Eric Johnson, who's the mayor of Dallas, Texas, that every location is so unique that really a lot of the decisions have to be made at the local level by mayors and then working up to our governors. So I don't mean to suggest that this is all of a federal effort completely top down, because I completely agree with you. There's going to be heterogeneity across our country. But we need to have everybody working together. And I think a lot of the coordination, some of the coordination needs to come from the federal government, but our states and local governments are providing a lot of the on the ground public health. They are the first responders on a large extent. And then as we start to rebuild, they're in charge of the schools, the local parks, and a lot of the places where people will go.
Can we imagine a situation in which, let's say, antibody testing improves? So not just detection of live infections, but say antibody response to see whether somebody has had it in the past. Can we imagine some administered mechanism in which people are tested and therefore safe to work, and coupling test and trace with identifying people who can be safe on the front lines? Say, for instance, I'll give you an example. Here at Princeton University, we've got local technical capacity. My colleagues over in molecular biology can grow, if they so choose, buckets of spike protein and can help run antibody testing. And one could imagine regional response. So for instance, this multi-state compact here in the Northeast between New York, New Jersey, and Massachusetts and other states. It just feels to me like some parts of the country are well equipped to actually implement a strong response if the will were there.
So I think this is going to be well beyond my expertise, since I don't know how realistic the antibody testing is, how reliable it will be. But one certainly could imagine that, assuming that we've got reliable antibody testing that really tells us that it's okay for someone to go back into the workforce, that especially for those working in hospitals that are coming into contact with people who are ill, probably are more vulnerable populations, it will be important to understand who among them is immune. And we could potentially deploy this. I understand some countries are thinking about already rolling out an ID card. I'm just not sure if that provides pulse security. I'm not sure how far it takes us. Does that mean if you have a card, you can go to work? If you don't, you still have to shelter in place. But we know that our workplaces are complex organizations in which we complement one another. So we can't just as a professor or as dean, I can go to work, but if I don't have any faculty to teach, that's not going to go very far in terms of the university standing up. So I think we're going to have to be more creative than that.
How fast does it take to restart? So we've seen how quickly an economy can stop. So how fast can a sector restart? Let's say hypothetically, a decision gets made to let a sector go back to work, whether it be restaurants or retail or manufacturing, let's say at the end of May. What would be the time course over which it would take that sector to become active again?
Well, I think that's a really good question, and it may well depend on the individual businesses and where they were in their own cycle. For example, a small business that relies on, that just got its stocks replenished, that had just had a shipment come in when they were ordered to shut down, has already fully stocked, at least in terms of the products and capital they might need to get going again, they're ready to go. So I think it'll depend on whether they have the supplies that they need in order to do their business. The second question is going to be, what happened to their workers? Do their workers still think of themselves as being employed, think of themselves as going back to that one particular employer? Or are they thinking, wow, I've been home now for 6 weeks and I kind of enjoyed working at mom and pop's shake store or something like that. But now that I've had an opportunity to think, I may want to go back to school and get trained as a massage therapist. And so that there's a transactions cost, if you will, as people think about actually changing employers. So to the extent that people go back to their jobs that they had when the economy was frozen, we will snap back a little faster. But to the extent that businesses have folded in the meantime, many entrepreneurs, even if this one business closes, they will come up with a new business, but that'll take some time. To the extent that workers don't feel themselves tied to that particular employer, that may take time. So I think it's going to, again, I hate, I sound like a broken record, but I think this will depend on how long this actually goes on for, and and the state of the economy once we actually start to turn it back on.
You've talked a lot about what the government can do and the importance and centrality of government, but there's obviously still a role for markets. This is a form of market failure for sure, but where can markets perform in a moment like this that you would be looking to for innovations that would be helpful right now?
Well, I think that's what we're seeing in many sectors. The technology sector is springing into action in a way that we haven't seen before, right? We are having this by Zoom, which is obviously it existed before, but we are taking advantage of it in a new way. And I'm sure they've had to up their game in response to the increased demand of their services. We see the scientific community, which has got a big private sector racing to develop faster, cheaper, more reliable testing for COVID-19, trying to develop therapeutics and vaccines. So the private sector is definitely springing into action there. And then you see other parts of the private sector trying to find ways for us to all stay entertained while we're in our homes and coming up with new ways for us to do that. So I very much agree with you, Julian, that our economy is based on a vibrant partnership between there's a private sector, there's a public sector, there's a not-for-profit sector. The not-for-profit sectors really had to step up as well, especially helping those who are falling through the cracks in our safety net. But it's going to take all hands on deck, shall we say.
And you did an interview, I believe on NPR, about what everyone's very worried about too, if we're heading into another depression, if this is going to be the 1930s. And for economics experts, it's hard to imagine how it wouldn't be. We have never seen the economy just shut down. How can we avoid that outcome from your perspective?
So even the economists, most of us were not around in the 1930s, and so have never seen this. And again, in the 1930s, that was from a true lack of aggregate demand that started, just before the war, and then it caused a stock market crash. They had the stock market crash, then they lost faith in banks in a way that we now have federal deposit insurance, and so I don't expect that we'll see the same run on banks that we saw in the Great Depression, which caused a spiral downwards. We have the Fed being much more aggressive to help shore up the financial sector. The longer it takes for us to get the pandemic under control, the greater the risk. I think if we can develop creative strategies for living with it. One question I have is which kinds of industries and businesses and occupations can be fully flourishing while doing physical distancing. We're all in higher education. Can schools like Princeton that are residential colleges, where students come and live together in dorms, which I guess have been referred to as floating cruise ships. So they're living in close quarters. Classrooms are typically kind of close quarters. Can we do our job while still trying to physically distance from one another and stay safe? Maybe it involves masks. I know that's what a lot of higher education leaders are trying to figure out right now, but that's going to be true in many sectors of our society. At the gym, can gyms operate in a way where the clients are far enough apart from one another that there's enough sanitizing going on between visits and between individuals that we can stay safe while we still do what we'd like to do?
So it's funny, it could accelerate and strengthen parts of the economy that were already growing, that rely on virtual work, even sales like Amazon, obviously. And one effect might be it just pushes a lot of commerce and support to those parts of the economy now.
Yep.
At some level, this is a big stress test of all these resources and capacities that we've built up. You talked about the private sector and the academic sector. Here on campus, there are people who have started mobilizing 3D printers to print swabs. So here in the Neuroscience Institute, there's a student who's printing close to 1,000 sterile swabs a day. There are people in physics and mechanical engineering who have come up with a cheap ventilator design in a way when it looked like ventilators were going to be in short supply. They've created Professor Galbiani and also some people over in physics have figured out ways to build cheaper ventilators. And I'm kind of curious about seeing how these different sectors respond to this massive stress test. One thing I'm curious about is back to this subject of relief. You make it sound more like a cardiac arrest or like falling into an icy pond as opposed to, being out of shape, where maybe if we had a natural recession, the answer would be, okay, you got to you're out of shape, so you got to exercise more. You got to take vitamins. You got to change your life. But here, this is more like the patient just fell into a pond and we just got to get the heart started again. And so it just feels like a very different kind of stimulus.
Or even it's a medically induced coma. So really we've put the economy in this coma so that we can address other issues, meaning the pandemic. And now the question is, how do we reverse that once we think it's safe to do so? Right. And I think that's what we're all trying to figure out.
One thing I'm concerned about looking at the data that's been coming out, you were talking about the CARES Act. I was looking at geographic data, and it looks like small businesses are getting very different amounts of relief depending on where they are in the country. So for instance, North Dakota and South Dakota are getting something like 70% of the payroll requests approved by the federal government. And then here in New Jersey, which is the second hardest hit state in the union in terms of deaths and cases of coronavirus illness, payrolls here are getting 38% of their requests approved by the Small Business Administration. So what are we to make of this huge heterogeneity? And is there something that ought to be done there?
Well, I have not spent my time. I think I saw some of those, that geographic distribution as well. I do know that some of it depends on relationships with bankers, that there were some very large companies that may be headquartered in some of the states that actually receives more of the money. That, you know, was not the intent in some ways of the bill, even though there were loopholes. I think what we see here is that this first attempt in the CARES Act for the Paycheck Protection Program was inadequate, that it didn't quite get to the places that we hoped that it would get to, and Congress is working on a fix. That said, I think it's really important that we have accountability. We stood up this program so fast that there's this question of speed, which I am in favor of, and I've said I think it's a time not to let the perfect be the enemy of the good. But that said, we do need to be able to look back and understand what went well, what didn't go well, and maybe even be able to claw back in instances of absolute fraud. So there needs to be accountability. This is a lot of money that's at stake, but we also know time is of the essence. Small businesses in particular that are truly small businesses have on average about 27 days of cash in order to stay liquid. And so it's not something where we can work for months and fine tune it and make it just right. We actually needed to get the money out as fast as possible. So I really do hope that the federal government passes this next round just as quickly as possible as well.
I want to, we've talked to you as an economist, but you were also working in an administration, also in a time of crisis still in 2009 plus. What did you learn from your experience being an economist in the room with policymakers and with other economists dealing with these issues that you think are useful today as we wrestle through some of these issues?
Well, that's a good question. One is that we have to be very creative, and we have to be thinking about lots of different people and using lots of different levers. For example, the very poorest in our society are supported by the Temporary Relief for Families, TANF, by TANF. TANF in the Recovery Act was given additional funding, and one of the ways in which some states use the funding was something called I'm going to forget this, but it was a way for there to be subsidized employment. Georgia was a classic example, a state that really, I think they employed over 100,000 very low wage workers through this program. And so that's just one example of trying to use all levers of our government to try to help individuals get through this crisis. One of the big concerns is that inequality, which was already a big problem in our country, is only going to be exacerbated. And it's going to be at many different levels. The low wage workers, both those who lost their jobs are really suffering. They are living paycheck to paycheck. But many of them are deemed essential workers, which means that they're more at risk for catching COVID, and we're seeing that they're having the excess medical burden, if you will, of catching the disease. If you look in our educational systems, schools went online very quickly. If a student doesn't have a computer, access to broadband, and is not able to take advantage of the online education, they're going to fall further behind. And the online education probably wasn't going to be so suitable for many students anyway. Some of the evidence, at least at the higher education level, is that students who are already struggling a bit in school is particularly not very helpful for them. So in our educational system, in our economic system, I think probably in our health systems, we're going to see just increasing inequality as well.
And the other hat is obviously you're the dean of a policy school at a university. And so how do you balance? I mean, there seems to be two imperatives. One is in the short term and long term, how do we deal with pandemics and what we're learning about the spread of viruses and how to make things safe? And on the other hand, we don't want to throw everything out because of what happened in the last few months. I feel sometimes the discussions in all institutions, it's like, all right, everything's new now. When we've spent centuries building our social fabric. And how do you balance how do you think of balancing those two competing demands in the months ahead as an education leader?
I actually think, as dean of a school of public affairs, I actually think it's a moment for us to step back and think about what's the relationship between the private sector, the public sector, and the not-for-profit sector. As you alluded to, our private sector is very important. It's vibrant. It's what makes America America. And I don't want us to lose that. But at the same time, I do feel that there's been a loss of faith in government, some of it probably deserved, but that we don't recognize, for example, those market failures that you identified, that there is, even for the staunchest person who believes in the free market, there are places where the private sector does not perform well. This pandemic happens to be hitting many of them in terms of showing up to work sick. You have a negative externality, might make others sick, you're not as productive, and yet you're not going to take that into consideration if you need your paycheck. In terms of our health insurance, health insurance systems are notoriously difficult because of the fact that you're most likely to want and need and be willing to pay for health insurance if you're sick. Unless you have a mandate or some requirement that people get covered, the insurance markets are going to be too expensive for the average person to participate, and you have the notorious death spiral. You have public goods. Public health is a public good. If we're all well, that's a system where the private markets doesn't have a huge incentive to build it because they don't know how to price it and to charge individuals because they can't exclude anybody. So what this pandemic has revealed, I think, are some of the cracks and some of the places where we haven't appreciated the role for government. So as a dean of a school of public affairs, I hope we both embrace and recognize the private market, but also understand that there's a very important role for government. And I really don't mean to be excluding the not-for-profit sector, which I know has really been stepping up. So a lot of these charitable organizations are stepping in, again, filling in some of the cracks for our government. But we need everybody on deck. It's all hands on deck. And I hope we can come out of this and sort through what are the strengths of each of these sectors, and not necessarily disparage, but to recognize the strengths, challenges, and build it better going forward.
I want to take this all more locally. We've heard about your role as dean and the role of the School of Public Affairs and macro policy and thinking about the problems at hand. But now let's just bring it all home. We're kind of near the end here to talk about what's happening here on campus. So here we are. We've sent the students home, they're gone. Summer programs at Princeton University are canceled through August 15th. What do you suppose, or what do you know is going to happen this fall? What do we know about what's likely to happen this fall when normally we open up the gates, the freshmen show up, we send them out to outdoor action, they learn the song, we had the pre-read. There's all this stuff where we welcome them here and they get to be with each other in this great big cruise ship. And so they usually come together and learn what it's like to be in this community. What do we think is going to happen this September?
So I don't know that we know yet. I know that there are groups of people working to try to consider many different scenarios. We at the Woodrow Wilson School are working to think through different scenarios. I think that it will depend a lot on how we're doing on testing in another few weeks, and what we think we can do in terms of contact tracing. It's my own interpretation that if this university can open its doors to students in the fall, it will, if it's at all possible. My own guess is that would only be possible if we can do some measure of physical distancing in welcoming students, but also keeping them physically distanced, which can be a challenge, especially for the young people that you just described. So we will see, but the university, I know, is considering many different options, as is every institution that I've encountered thus far.
I'm just imagining the classrooms and thinking, for some of our larger classes, we don't even have the physical capacity to house students for, say, a 300 or 400 student hall. Those are our very largest classes, yep. Right? If we have to sit them 6 feet apart, that's just a huge problem. But
you could imagine a hybrid where some of those larger classes are done online, and then it's more the smaller classes that are done.
Or section them, so have like multiple sections and just and work the faculty a little bit more to have us deliver our lectures at different times, something like that.
Exactly.
I'm really interested in this model of testing in which one can have, you discover a case and then you do this like hardcore CDC style, like the movie Contagion, where like they illustrate how CDC workers trace all their contacts. You just say, okay, you got a fever. You're going to go over there into Maddie, and you're going to go into that corner of Maddie and stay over there. And then we're going to just trace every single person. And then, okay, we're just going to isolate this wing of the building for a while.
Right.
And so if we could build that kind of capacity, and the thing is, what about other universities with fewer resources than Princeton? I mean, this is a hard problem. This is millions of students.
This is, not every institution is so residentially based. So I actually think this is a place where some of our larger institutions that don't have a lot of students in dorms, but the students are living in apartments anyway, might have a bit of an advantage. And where they may already have more of their courses online, so it's not quite the same model. So that's how I imagine many of them are considering. But you hear institutions considering starting the fall semester later. Maybe as like BU has come out and sort of suggested that one of the potential options may be starting as late as January for the fall semester and then pushing through the summer. It's just an option. I think they're just trying to be prepared and figure out what are the various ways we can respond. I think many recognize that the way that they've gone online this spring was a little haphazard, that faculty did a heroic effort with their IT teams, did a heroic effort, and it was a really amazing pivot. But that to contemplate that for the start of a new semester, we'll all have to up our game. So how do we do that and still make it a really vibrant and valuable educational experience, I think is the question. But this is the question at hand, is how can we do this as we are waiting for the day when this virus is not nearly as lethal and not nearly as not detrimental to our health.
We are out of time. It's nice to know that you are one of the people working on this and hear voices who are thinking through the path forward. Once again, our guest was Professor Cecilia Rouse, who is the Dean of the Woodrow Wilson School. Thanks so much for joining the show.
You're very welcome. It was a pleasure.
And once again, you can find us on iTunes, SoundCloud, Stitcher, and Spotify. Our website is politicspolls.princeton.edu. All the archives are there, as well as guest information. And thanks, everyone, for joining us. And we'll be back soon on Politics and Polls.
Bye, everybody.